Hello, everybody. We are going to give a little background information about our case study. Our individual is Jennifer. She's a 30-year-old biracial woman. Her father was Caucasian and her mother was Filipino. She grew up in Seattle in a primarily exclusive or almost primarily exclusive Filipino community. She has since moved to Dublin, Ohio with her husband, Jeremy, who is a doctor. But her father died when she was 3 years old. Her mother remarried shortly thereafter. Jennifer's stepfather had an explosive temper, and while she was never physically abused, she and her brother and the entire family lived in fear of his outbursts. Jennifer's mother became more and more withdrawn as the years went on. She went through long periods of what she called feeling blue. During these times, she would sleep on and off all day, crying frequently and didn't have the energy to complete the most basic household tasks. And as a result of that, Jennifer, as a teenager, took on many of her mother's duties. Jennifer always swore to herself that her life would be different. She married an even-tempered man, Jeremy, the one I had mentioned previously. He is a kind and reliable individual who is completing his residency, becoming a physician in Seattle. Upon his completion, they moved to Dublin, Ohio. She and Jeremy have 3 children, ages 2, 4, and 7. Jennifer is a stay-at-home mom primarily, with her life revolving around her family. She and her husband, the physician, moved to the suburbs of Columbus, Ohio 3 years ago when he was offered a position at Wexner's Medical Center. Since the move, Jennifer has met a couple of young women, also young mothers, and she sometimes connects with them and organized play groups, but she has not developed any deep relationships with them over the years that she's been in Dublin. She has not worked outside of, or she stopped working outside of the home. She reports not feeling right since she moved to Dublin, Ohio, or since they moved to Dublin, Ohio. She describes herself as unmotivated and tired all the time. Jennifer frequently cries and often feels hopeless. When asked if she would ever harm herself, Jennifer denies that she would, but does go on to say that sometimes she wishes she would fall asleep and never wake up again. Jennifer is fearful of telling her spouse about her symptoms and believes that he would see it as weakness. And Jennifer and her family, because her husband Jeremy is a doctor, they have really good health insurance, Prime Care Advantage through Ohio State. And so what we know about Jennifer is that her and her family live in Columbus, or just in the suburbs of Columbus, Ohio, that had left a primarily Filipino community in which she was strongly established. And that we also know that within the Filipino community that there's this sense of togetherness that is primary in their culture, and Jaden will touch on that a little bit further. They have 3 kids. She's primarily a stay-at-home mom. Their oldest child is of school age, and the other 2 are of younger stay-at-home age, ages 2 and 4. And it is her primary responsibility as a homekeeper to stay at home with the children.
So things that we wanted to pay attention to were various cultural influences. So as far as seeking help, who we should turn to, acknowledging health concerns and public stigma. We also wanted to pay attention to cultural and social demographics of Dublin. So Dublin happens to be 74.42% white and 18.26% Asian. Among others. So we wanted to pay attention to that as far as the resources that we could provide Jennifer and different access that she would have within that area. We also wanted to pay attention to biracial representation. So because Jennifer comes from a biracial background, we wanted to include that within the resources that we provided her. And another important thing that we wanted to pay attention to was suicidal ideations, because she claimed that she wouldn't cause harm to herself, but that part where she mentioned she would want to fall asleep and like not wake up again, we wanted to keep that in mind.
One of the things that we were looking at, and I am playing the role of the PCP in the video that you guys are about to watch, was using that as an entry and access point from appointments that Jennifer already has, because she is in a position in which She hasn't harmed herself, but it has come up in conversation with the PCP and not through conversation with her husband. And through the research that we did in Dublin, based on in-network use of her research, because she has really good insurance options, we were able to find, both myself as the PCP, who I am playing a female of Asian ethnicity named Dr. Fu, and Bella is playing the Sarah Boyle, who is the psychiatric nurse practitioner.
Yeah, so also going back to cultural expectations, so there's a strong belief that treatment from professionals should be used as last resort. And so we wanted to also include some holistic medicine, such as yoga and meditation, which has been shown to be really helpful with people with PTSD, stress, and anxiety. And knowing that Jennifer does have sort of a traumatic history, that, you know, maybe these things would help her connect with herself, her body, and her mind. Yeah, so hopefully, you know, we're hoping that that would be helpful for her too.
And then with the connection of Sarah, and we included Ruth, who is a job coach, the theory and hope is that we are able to provide care for Jennifer in a way that she's able to address the feelings of rightness and hopelessness that she's feeling since they've moved to Dublin, and reestablishing a sense of community with the Filipino Society of Central Ohio, and then using Ruth's services, who is portrayed by Hannah, to prepare her for the potential of when her children are in school.
Yeah, so I play Ruth, who is a job coach, and basically the purpose behind that was to offer her a service where, if she was interested in working, since she is a stay-at-home mom, we wanted to give her the opportunity to start a career or look into job opportunities. So when her kids are all of school age, she would not be stuck at home alone and not be as a risk as she might be if she was home alone. So we wanted to give her a job coach so she could see the opportunities that are out there.
Mm-hmm. Another thing to mention too is that we were able to find her good childcare options for when she does want to use these resources, which also might be helpful for her to kind of ease into, you know, not having her children 24/7. Yeah.
I think another thing that's important to mention as far as playing the role of Jennifer, because I have good insurance coverage, a lot of the resources that were provided to me could actually be paid for out of pocket, because I have good insurance, but also financial stability. And a lot of people don't have that access. So that allows me to have far more resources than many could have.
Yes,
So,
I think in addition, with like the financial resources that she has, it's really good to know that, you know, she'll be able to find transportation and be able to pay for childcare, in addition to, you know, yoga classes or meditation and stuff like that, you know, isn't covered by insurance.
Yeah, and so an important thing to remember as you're watching the following clip is that the timeline of this is a little is interesting, because we're trying to set Jennifer up for long-term care, and because we're putting it in such a sort of short, compact window so that everybody can view this, it may not play out this way in actuality. The conversation with the PCP and Jennifer might still play out the same way, but how it's introduced to the psychiatric nurse practitioner, and then therefore to Ruth as the job coach, the timing of that might not be the exact same way. And I hope you guys enjoy, and we look forward to talking to you during class time. Thank you. Hi, Jennifer. Good morning.
Good morning.
How are you doing today?
Today's been a better day than most.
Good. I'm glad to hear that. It's really good to see you again. I'm glad that you could make time for us. This is really important. I know that you're super busy with your adorable little children. They're getting huge, really amazing. It was really great to see them last time you were in.
It was good to see you as well. Busy is an understatement. They're growing up so fast, I can hardly keep up.
I can totally understand that. I wanted to follow up regarding the conversation that we had last time you were in. You mentioned that you've not been feeling right since you and Jeremy moved to Dublin, and that sometimes it leaves you feeling a little bit tired, a little unmotivated, and I wanted to find out if you're still feeling this way.
Yes, I still feel the same as when we last talked. Considering it's been 3 years since our move, I figured that these feelings would reside, but I still feel the same way.
I'm sorry to hear that. Moving across the country can be really challenging. It's not an easy undertaking. You also mentioned the last time that we spoke that when you find yourself alone, that you're crying and that you're feeling sad and a little bit hopeless. And I wanted to find out if this is still true, and if you still find yourself crying when you're in moments of those precious moments of being alone.
Yeah, so this is still very much my reality. I think my mental state just continues to worsen as time goes on.
Okay, thank you for being honest. I really appreciate that. And this is super difficult. So as you mentioned, these concerns and feelings, and based on the conversations that we've had through this appointment and the previous, I wanted to, and the last time that we spoke, you gave me your consent to sort of share some of your information with other providers as I sort of reached out to see what services were available to you. I have a little bit of experience with psychological and psychiatric care, but it's not my primary focus. And so based on that, if you're okay with it, and if you'd be interested, I believe that it would be beneficial for you to explore some other sources that will help you get to the bottom of these occurrences and feelings with someone whose primary focus is to do so. Does that sound like it would be something that's interesting to you?
I'm not so sure. There's so much I'd have to consider before I can make a decision.
Yeah, these are big decisions, and I completely understand that. And I understand that there's lots of factors that go into making considerations of this magnitude. But I strongly believe that it would be in your best interest long term to take advantage of this. And as things stand, if these feelings continue to accumulate and we wait longer to address the issues at hand, I think it'll be more challenging.
Yeah, I agree. Okay, if you think it's in my best interest, then I'm willing to connect with them.
Wonderful. That's fantastic. Thank you for being brave and courageous in doing this. This is big stuff. So the first person I would like to introduce you to is Sarah Boyle. She is a psychiatric nurse who will be better suited to assist you with finding through and sifting through the rightness and the hopelessness that you're feeling. So here comes Sarah.
Hi, how are you?
I'm good. How are you?
Good. It's wonderful to meet you. You have been referred to me by your primary care physician. Can you tell me a little bit more about that?
So I moved to Dublin about 3 years ago with my husband and 3 children. Prior to our move, we lived in Seattle, Washington, and that's where all of my immediate family is currently located. But since the move, I haven't really been social. I did meet with a few young mothers, and we connect a little bit as far as with our children, and we have play groups and stuff like that. But other than that, I tend to stay at home and just care for the children. But since the move, I haven't really felt right. I don't really feel motivated anymore. I cry a lot when no one is around. And sometimes like I feel as if I want to fall asleep and never want to wake up.
Okay, well, it sounds like you are stressed out and feeling a little down because you've moved away from your support system and don't have anyone in Ohio that can be here for you.
Yes, I think you're right. My family means the world to me, so not having them here has been really tough.
Well, how would you feel about coming to see me maybe once a month for the next few months, and we can talk and better get to know each other and maybe talk about possible medication management programs for you?
Sure, I think I could do that.
Okay, that sounds great. I actually have been thinking about a few options that may be more beneficial for you in the current time.
Okay, I'm interested in learning more about them.
Okay, I know about a social group called the Philippine American Society of Central Ohio. They're a good networking option for you to meet other Philippine American women and men in your community. I understand that this group is not close to you. However, I am aware of some events that they're having via online live streams and Zoom meetings within the next month. I would love to get you involved with them and hopefully they'll be able to connect with you.
Yeah, I didn't realize anything like that existed in our area. I love to get involved with the online community.
Yeah, totally. I think that, another helpful option that I know about is a yoga class that is doing class via Zoom. It's actually right in Dublin. However, because of COVID, they're doing live streams of their classes. I've heard really great things about them, and their teachers are super professional. I think that yoga can be a great way to get in touch with your body and connect it with your mind and spirit. A great book that maybe you'd like to read that mentions this is The Body Keeps a Score by Vander Kolk. He mentions how yoga is a great way to heal the body from past trauma, and I think it's super helpful.
That sounds great. Can you send me the information?
Yeah, I'd love to.
So I'm also concerned about not having any passions for my future in terms of working. So I'm afraid that when my younger children go to school, that I won't really have a purpose anymore, seeing as I spend most of my time with them at home. But I also haven't considered childcare options outside of
Mm.
at home.
Yeah, for sure. So I know of two really good childcare options that would be, a great fit for when you want to do your social events and maybe join a yoga class. It'll definitely give you some more independence. One is called Primrose School, and the other is called Mango's Place. They're both located in Dublin, and they offer partial day and full day options. And in terms of a career, maybe working in your future, I know a great job coach who can help you more with that issue. Would you like to be connected with her?
Yes, please. Can you also send me the information for the childcare options as well?
Yeah, I would love to. I will send you an email after we meet. So the job coach, her name is Ruth, and I could get you on the phone with her right now.
Sounds great.
Here is Ruth.
Hi, Jennifer. How are you doing today?
I'm doing good. How are you?
I'm doing well, thank you. It's great to connect with you for the first time. I'm really looking forward to getting to know you and offering any assistance that you might need when it comes to a job.
Yes, it's great to finally meet you as well.
So why don't I start by telling you a little bit about myself and my business, what exactly I do and what services I can offer to you. And then you could ask me any questions or let me know if there's anything that you'd be interested in or if you want to work with me.
Sure, that sounds great.
Great. So I'll start with telling you about what I do here as a career navigation coach. So I've been writing professionally for about 35 years, and I have realized that I really wanted to help people more one-on-one with their careers and connect them with opportunities that are out there. So I offer a variety of different services to different clients, focusing on defining who you are professionally and setting up resumes on the online business profiles, etc. It depends on each individual client and their wants and needs, really. So, but mostly my goal is to prepare a client for summarizing themselves for a potential employer, setting up a resume, and just overall giving you a boost of confidence for searching new employment opportunities. I also offer short consultation sessions to see if we'd be a good match together and what I could just do for you and your career overall. So that's just a quick summary. Do you have any questions?
That sounds really great. But I do have a few concerns. Due to being a stay-at-home mom, I don't really have any professional experience outside of what I do daily, but I do have a bachelor's degree, although I haven't really pursued a career with it yet.
So I'm glad you're interested, and I see those concerns. Like I've mentioned, I work on a very case-by-case basis. So all of the advice and help I can offer you is specifically customized to you. So while you may not have that much experience, we can work on creating a resume that discusses some of your personal strengths and try to get your foot in the door with some professional experience or a smaller scale job. And yeah, there's a lot we could do with that.
I think a smaller scale job would be a great start, but I also think it would be in my best interest to wait until my 2 younger children are in school, so I wouldn't have to really worry about the childcare aspect.
Right, yeah, that makes a lot of sense. So that sounds like a great idea. I would love to discuss any more concerns or questions you have. I'm really excited at the prospect of working with you in the future. So when you're ready to talk to me again, you have my email, so just feel free to contact me and we can dive into exploring a career that best suits you.
Sure, that sounds great. I appreciate you taking the time to meet with me today, and I will be in touch.
Thank you, Jennifer. I look forward to hearing from you soon. Take care.